Hi, my name is Quincy Williams, and I'm a student physical therapist here at Regis University. And today I'm just going to present a little short video about what pain is. Now, I know everybody knows what pain is, but really get into some specifics when it's good, when it's bad, and just overall factors that feed into pain for every individual. So, like I said before, pain is adaptive. I know that's kind of a weird concept because we usually think of pain as being so negative, but if you think about it, pain is your body's way of telling you that there's something wrong with it and that we need to address it or leave it alone and let it heal. There are special types of receptors called nociceptors that do that. They send the signal whenever, if you burn your hand, you touch a hot stove, and it sends that signal up to your brain that tells your brain, take your hand off of the hot pan. If you didn't have that and you left it on there, you could do a lot of damage. And specifically more about pain, there's two types, acute and chronic. Acute pain is kind of what most people think of. You know, you're out for a run and you twist your ankle. Your ankle hurts if you put pressure on it. It's your body's way of telling you, hey, we've done some damage, we need to not use it. And then, once the tissue heals, your foot doesn't hurt anymore. Kind of makes sense. And that's the adaptive type of pain, like I mentioned before. It's your body telling you things are wrong, we need to lay off of it. Then you have chronic pain. Now imagine if you twisted your ankle and instead of just hurting for that, couple days, week, or whatever, it started hurting for months and years, long after any damage has already healed, any inflammation, um, tissue damage, trauma, that sort of thing. But it just hurt all the time. That's because your body's kind of, instead of just firing at a certain stimulus, at that twist, at that stretch, whatever, it's just firing all the time. Your system is just so sensitive, it just keeps firing and firing and firing with no real reason to fire. I mean, that's what's called that chronic pain. And that pain is definitely real, but it's so hard to manage because there's no real cause behind it. Pain also just has so many different psychological components that go into it. Past traumas, emotional experiences, even your mood can have an effect on pain. For example, somebody that has, maybe a negative emotion associated with a past injury, if they injure that body part again, they'll feel that much more intense than somebody that doesn't have that previous emotional attachment. Same goes with mood. A depressed person is going to feel pain much more than somebody in a happy mood. And it's very important for your healthcare provider to consider all these different factors regarding your pain, because it is such a subjective thing. In addition to all those factors I just mentioned, people experience it different. What's a 10 to me might be an 8 to you or 6 to somebody else. And that's why it's so hard to get kind of a hold on that. And that's why it's important to keep everything in mind when you're treating and talking about pain. And definitely let your healthcare provider know about those factors because, we're trained to take those into consideration. And it's important to mention those type of things. And we know that that type of, chronic, pain for no reason is definitely real. The example I always like to use is people who have had, amputations or part of a limb removed. There's a phenomenon called phantom limb syndrome, in which they feel pain in a limb that doesn't exist. They're definitely experiencing that pain, and there's clearly no reason why they should have that experience. So definitely, your pain is real. We understand that, and as healthcare providers, we're here to help you manage that. And there's other options that are non-pharmaceutical that you can do so. Mindfulness training, meditation. There's also some exercises. I know that as a student physical therapist, we've talked about that and learned some exercises you can do to help alleviate those chronic pain symptoms. So definitely just talk with your healthcare provider, and we'll be happy to help you with anything. All right, thank you.